All right, guys, so just a little mobility tip for today. If you are lacking getting into that bottom position of a squat, there's a couple things that'll really restrict you here. The first would be ankle dorsiflexion, and that can happen on either side. The second most common is actually going to be internal rotation at the hip. And then if you have like something on your back, it can definitely be thoracic extension too. Today, we'll focus on internal rotation of the hip. So I'm going to go with my right hip here. So I want you to get into this 90-90 position. You can do a couple different variations of stretching here. We're going to focus on the backside leg. Okay, so I want this out at 90 degrees, making a nice 90-degree angle here. From here, I want you to rotate your whole body into the backside hip, meaning I'm rotating my pelvis over the downside femur. You should feel a deep stretch in the hip capsule in this position. Okay, if you're someone who's very bendy naturally, feel free to actually reach this arm across. And I know some people that can even grab onto either their calf or the bottom of their foot. And if you feel a better stretch and you're still keeping your spine neutral, great, do that, okay? And then the other thing to point out with this is the other knee does not need to stay down when you're stretching into internal rotation. Now, if I were doing external rotation, that would be a different story, okay? So if you are someone who really lacked this range of motion, I would want you to hold this stretch for 2 minutes. To change the architecture of the tissue in the hip, a 2-minute passive stretch is basically what's been shown to be the minimum threshold that's going to actually change the tissue over time. Okay, so I'm going to show you some Pales rails from here. So Pales rails is essentially loading both sides of the joint. It's progressive angular isometric loading and then regressive. So from here, in this position, we're going to get to our end range. Again, if this is too easy, reach across and really get into that hip. If it's too hard, feel free to rotate out of it a little bit. You can also grab a yoga block if you're getting medial knee pain or any pinching in the hip. Bring that up, see if that helps. A lot of people, that'll take away the knee pain. If you're getting pinching in the hip, you can try this, or just lean yourself away and back a little bit, and that'll open up this hip capsule so you're not getting that pinching feeling. All right, from here, we're going to push down into the ground 25% of your maximum capacity. You're not moving in any isometric, right? So this is almost a skill in and of itself, is to learn how to do good isometrics. So you're creating tension down into the ground with this entire shin, okay? I want you to think about all of that pressure, though, coming from the hip rotating like this. So it's kind of doing this, right? It's trying to rotate everything this way. Now I want you to build up to 50% and 75%. So now this is starting to get hard. And if you've never done this, you can just end at 50 or 75%. You can bring intensity the more you do these. I'm going to go to my greatest, safest, pain-free effort. So I'm going to be pushing down as hard as I can. I'm going to hold that for 10, 9, 8, 7, 6, 5. Thinking about it all coming from the hip. Feel those fibers and kind of your deep glute firing. 3, 2, 1. Don't lose this position. Now we're going to think about driving our foot up towards the ceiling. Lift it up. You're going to feel this on the front part of your hip and your TFL here. This one is immediately into your greatest, safest, pain-free effort. Hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And relax. The other thing is, if you are getting pinching in the hip, feel free to go down onto your elbow. For some people, that's a great way to do it, okay? Now we're going to do some lift-offs to lock in that end range movement. So this one, we're going to be lifting off the block, keeping the knee on the ground while stabilizing up in our core and making sure we're not getting a bunch of unwanted kind of extremity or torso movement in the pelvis here. Okay, so from here, we're going to be nice and stable, and I'm going to lift up. I'm going to hold for 5, and then I'm going to come down. Same thing, if that is pinching or anything in the hip, feel free to come down onto the elbow. It'll be the exact same thing. If this is too challenging with the yoga block, just take the yoga block out and go onto the ground. All right, so let's go here in 3, 2, 1. Lift up. Keep your knee on the ground. Hold for 5, 4, 3, 2, 1. Parachute down, up again. Hold for 5, 4, 3, 2, 1. Parachute down. Brace the core, nice and solid. Bring it up. 5, 4, 3, 2, 1. Parachute down. 2 more. Nice and stable. Irradiate. Create some tension with your body. And up. 5, 4, 3, 2, 1. Parachute down. Last one here. 5, 4, 3, 2, 1. Parachute down. All right, so that is just a snippet of what you would see in a Kinstretch with Kirk class. The classes are anywhere from 15 to 30 minutes. They're not going to take up too much of your day, and you can select different ones on different days. We also have built out roadmaps that will help you along the way and allow you to tailor this program to what you need to perform your best, to feel better, to move better, and to function better. If you have any questions, feel free to ask, and the link is included in the description.